Hey, it's Jay with Jay. Speak Your Truth, week 3. Week 3. Can you believe it? You've seen me for 3 weeks straight. Yes, I've been coming here for 3 weeks straight for Suicide Prevention Awareness Month. Yes, I'm giving you some information about suicide because we need to prevent anything from happening. Okay, so let's dive on in. I cannot promise that I will keep you the whole 30 minutes today because life has been lifing, and baby, I have been going through. Okay, today we're going to talk about suicide as a public health issue. Again, Suicide Prevention Awareness Month, September. That's the month. September. This is week 3. Suicide as a public health issue. Let me give you some facts on some data. Over 49,000 people have died by suicide in 2022. Over 49,000 people have died by suicide in 2022. Many adults think about suicide or attempt suicide. 13.2 million seriously thought about suicide. 3.8 million made a plan for suicide. This is what I'm going to do. This is how I'm going to do it. 1.6 million has actually attempted suicide. I made my plan. This is how I'm going to do it. This is when I'm going to do it. This is where I'm going to do it. And I'm attempting to do it. I made that plan. Then I went and attempted to do it. 1.6 million people. It's a public health crisis. It is a public health crisis. The community is affected. The family, the world, everyone is affected by suicide. Don't think that it's not, that we are not. Everyone. 1 death every 11 minutes. 1 death every 11 minutes. This is coming from CDC. I'm not making this up. This is from the CDC report for 2022. We have to bring awareness. We have to talk about it, and we have to let our family and friends and co-workers, church members, whoever, we have to let them know that this is not okay. You are not okay. Girl, it's okay to not be okay. Let's just talk about it. Let's figure it out. Let's make a plan. Let's see how we can help each other. Let me help you. Don't get mad. Don't get frustrated. Don't get upset. It's okay not to be okay. Let's just talk about it. If we want to make a plan, let it be a plan to get out of this darkness, out of this feeling alone, out of this sadness, out of this depression, out of this feeling we don't belong. Let's make a plan to live. Let's make a plan to survive. Let's make a plan to get help. It's a ripple effect. Each suicide deeply impacts family, friends, co-workers, family, again, church members, the entire community. Everybody is affected by it, by suicide. Everybody. It's not just your little circle. It's not just your family. It's everyone. Because somebody knows somebody that knows somebody that knows somebody, and the word spreads. The emotional, financial, and social consequences can last for years. You thinking about yourself, but we also have to think about who we're leaving behind. Our family and our friends, especially our families. What they have to deal with, the questions, the unanswered questions that we will have, that they will have. What could I have done different? What could I have said? What did I say? What didn't I say? How am I going to pay these bills? How are these kids going to survive? What am I going to tell these kids? What am I going to tell his mom? What am I going to tell his dad? It's so many unanswered questions. So when we go through in the moment, we're thinking about us, how we're feeling, which is rightfully so. But just take a moment and think about who and what we're leaving behind, how it will affect them. Because it's a long-lasting effect. Years, a lifetime. You just don't get over that. It's nothing to easily get over. There's a lot of vulnerable communities, groups. Some, and this is not all, but research has shown that some of the groups who have higher suicide rates are teens, veterans, LGBTQ plus individuals, people living in rural areas, and those who are already dealing with mental issues, substance abuse, or finance issues. You're already dealing with stuff, right? I'm a veteran, so I feel like I can't fit back into the civilian world, into society. I don't feel in. My family don't understand. My friends don't understand if they're not military and they haven't been overseas or they haven't served in the service. They don't understand the nightmares. They don't understand the different things that I go through. So now I'm excluded, or I feel excluded, or I exclude myself because my mind is telling me I'm excluded, or they're excluding me, or they're treating me different. Because I drink more than they do, or I start drinking because of this, or I'm being bullied, teenagers. It is a gnat that has been in my office all day. 2. Well, I guess it's 2. I killed one, and then I laughed, and I was like, that was so-and-so, right? Because I just lost someone very important to me. And I was like, oh, But then, a few minutes later, another gnat came. So I haven't killed that one. But it keeps nagging me. Kind of like he did. Like a little gnat. Whoa. Anyway, just a little humor to get through that moment. But yeah, you having issues, finances. Like I'm robbing Peter to pay Paul, trying to figure out how I'm gonna pay this bill and what I'm gonna do with this. And you know what? Life just might be better if I don't have to deal with this. So all this stuff, all these issues that I'm already dealing with, you're gay or bi or trans or whatever your issue is, and that's not an issue, I'm not saying, but whatever your situation is, right? You already feel like society is against that and judging you and making you feel some type of way, and then now you have all these things that's going on in your mind and you're dealing with that, and it's just too much. So What do you think about? Unaliving yourself. Suicide. Life is a whole lot easier. I don't have to deal with this. Why should I deal with this? No, baby. Forget suicide. Forget society and what they feel. You are your own individual. Be you. You're a veteran. You served this country regardless of what you did and how you did it. Walk around with your head held high. Don't let the stresses of the world stress you out. Easier said than done. Jay, speak your truth. Because, listen, I've been there. I still have those struggles. But then I have to snap at myself like, girl, these civilians don't know nothing. They couldn't stand the test of time if they had to go and do half of the things, a couple of hours doing what I did. Please. Okay? So, encourage yourself. Push through, honey. Pray until something happens. That's what you do. Don't allow any situation that you're going through control you. You control that situation. You don't have it. It don't have you. You have it. That's it. Whatever it is, it does not have you. You have it, meaning you control whatever situation you're going through. Overcome. Mind over matter. Mind over matter. Control your mind, because it don't matter. Mind over matter. Push through. Look at how far you have come, because I'm pretty sure this is not the first obstacle that you'll face. And it won't be the last, as long as you got breath in your body. You'll get over this. This demon, this battle, it ain't yours, baby. Pray about it. Me, I've said it in every video I have done. Jesus, I'm calling on him. Help me, honey. I need you. Lord, help me. God, help me. Lord Jesus, I'm calling. And if I ain't called his name this week, I ain't called him ever. Baby, I have called him. So whoever you look up to, you believe in, call him. But for me, it's only one. And that's who I'm calling. That's where I get my strength from. Now the little net feel like it's gonna bit me. I talked about him, so now it bit me. Again, I discussed the warning signs. You have to be vigilant. Hear, listen. As I said, you don't listen to respond. You listen to hear so you can help. Understand with compassion, empathy. Verbal cues. I can't take this no more. I'm done with this. You know what? I'm just better off. My kids will be better off. My family will be better off. If I'm not here, I'm mentally tired. I can't do this no more. I've had enough. All those things are things that you need to pay attention to. I would say it over and over and over again. I don't care how it bothers you. I'm going to say it over and over because I need you to know. These are warning signs, and you all need to know that. When your family and your friends say it, it doesn't always mean that that is their thought process. But that's something that you need to be vigilant and you need to pay attention to. Don't just say, boy, you fine. You say that all the time. Go to sleep. Get some rest. Find a new job. Leave her. Leave him. No. Talk about it. Can we talk about that? What you mean? Explain more. How do you feel like the world would be better off without you? Where you going? Dig deep, baby. Dig deep. Get answers. Let them know that you heard what they said. Even repeat it so they can hear. It might sound different. I said this before. When you say it and they hear it, you speak it out loud, you be like, oh wait, I mean that. So say it, repeat it, have that conversation. Don't just brush it off. If it's in a text message, repeat it. Call, pick up the phone. Don't lose somebody because you don't have time to ask questions. It's too easy. It's too easy. Just ask questions. Again, we can try as hard as we can to be there. And suicide is preventable. It is. By simply listening. Letting our family, friends, co-workers, church members, whoever we come in contact that gives us signs that we listen to, letting them know it's okay not to be okay. It's okay to talk to somebody. It's okay to get help. It's okay to call 988. It's okay to send a text message to 988. It's okay to reach out to Jay. Let her help you. Ask her. Talk to her about it. It's okay to get help. That's all I need you to know. Educate yourself and others about the warning signs of suicide and how to intervene and make a life-saving difference. Schools, workplaces, and communities all should offer support for mental health awareness, and majority of them do. You just have to reach out and ask. Look for that resource. EAP if you have a job, federal, state, it's available. And a lot of the, I want to say civilian, a lot of the private industries have EAP, Employee Assistance Program. You can call and talk to a counselor for free. It's included in the plan. Take advantage. You have health insurance. You can get that also. You don't even have to go inside. You can call on the phone, do a telepath video. You can do it. It's easy. You don't have to make excuses. You don't have to say what you can't do. I can't take off. I don't have time. I already taken off because little Johnny was sick. I had to take off because I had a family vacation. I need to save for a family vacation coming up the holidays. It's okay. Telehealth. Just go to lunch, sit in your car, call on the way to work, after work. 988 is available 24/7, 24 hours a day, 7 days a week. Your mental health is important. We all go through life changes. We all need someone to talk to. Take advantage of the services that are out here for you. Don't ever feel like you don't have anyone to talk to, because you do. And it doesn't have to be someone you know, a complete stranger. And they will let you know that they care about you more than anything in this world. And they won't be lying, because we all do. Your life matters. It matters to me. I need you here, and I don't even know you. The world needs you. You could be the one person who can make a difference. We have to continue normalizing discussions about mental health, because it helps to remove the stigma about seeking help. We have to encourage the dialogue, the conversations with our family and our friends, especially our teenagers. We have so many young people who feel like they can't talk to their parents, their siblings, their grandparents, their guardians, anyone. They just want to belong. Little Johnny just want to belong. That's it. They have a hard time at home because they have a single mom. She's trying her best. He has to wear hand-me-down clothes. To him, they're fine because his older brother gave them to him. That's an honor. He's proud to wear his brother clothes. But he goes to school and Jack talks about his clothes. So now he's ashamed of his clothes. And he sits in the corner. And he's no longer smiling and happy and bubbly. And he no longer wants you to see his Nikes or his Adidas or his New Balance or his Skechers, whatever they are. Because Jack has made him feel that they're not good enough. So now he has an attitude all day. He's down, he's depressed, he's mad, his behavior changed, his conversation changed. He goes home. Mom is working, come home late, trying to fix dinner, doing the best that she can. He has no one to talk to. On the weekend, when she finally gets the chance to talk to him, he doesn't want to talk about it. He's now in a shell. And she's like, "What's wrong? What happened? Tell me about your week at school." He downplays everything, or he makes everything seems like it's fine when it really isn't. Or he tells his mom, and she's like, "Oh, don't pay Jack no mind," and downplays it and brush it on and moves on to the next subject. Now he's second-guessing himself, second-guessing his worth and how he's going to get through, and doesn't want to go to school and feeling bullied and all these bad, terrible things. But mom is doing the best she can because she's a single mom. But we have to take a moment to pause and notice little Johnny is not as happy and bubbly anymore. Little Johnny no longer wants to wear his brother clothes. He always wants to know, "Mom, can you buy me a new shirt? Mom, can you go buy me a new pair of shoes?" He's always asking for new now. He's no longer excited to wear his brother stuff. That's a sign, Mom. He doesn't want to go to school anymore. That's a sign, Mom. She doesn't want to hang out with her friends anymore. She doesn't want to go over their house anymore. She doesn't want to go to the playground. That's a sign. She only wants to sit in her room with the door closed. These are signs. There's a lot of different other signs. They only want to sleep. They cry all the time. Didn't used to. It's just different things that we have to notice with our kids, even with adults, that are signs. We won't catch them all, but we have to start paying attention, and we have to start listening so we can catch some. One every 11 hours. Correction. One death every 11 minutes. Can we catch one? Can we catch them? Just try. If I listen just a little bit, I'm listening to answer you, I'm not going to get it. Because I'm picking up my answer in my head. I'm listening to what you're saying, but I'm getting my answer. But if I'm listening to hear what you have to say, I need to understand what you're saying. I'm going to hear your words. I'm going to hear some of the signs, and I'm going to be able to pay attention just a little bit more. There's a difference. Don't listen to respond. Listen to hear, to understand. Counseling and therapy. Connecting people to mental health services, including counseling and therapy, is essential. It's important. It's critical. It's a must. Many communities offer low cost and free mental health services. I just told you about the EAP. If you're working, if you're not working, you can go to a local health clinic. You can call 988. You can text 988 24/7. There is someone there willing and waiting to help and assist you. Support your loved ones. Don't judge them. Don't make them feel worse than they already do. Let them know that you're there and that you care. Reach out. Do those follow-up calls. Don't just say, hey girl, just checking in. No. Let's do lunch. Are you available this weekend? I know last week you said, let's go out so you can breathe. Let's talk about it. How are you feeling? How's things going? The first video I said, you can Google inspirational text, inspirational messages. Do that once a week, every other day. However often you feel like you need to. Whatever that relationship is with you and that person, do it. You never know. It could help them at any moment. You could be the one to save a person's life. Don't forget that. That is important. Again, follow through. Have those uncomfortable conversations. They're uncomfortable for a reason. Again, you could be the one to save a person's life. Of course, get involved. Stay involved. Reach out. Communicate. Let people know that you're there, that you want to help, that you want to assist. Don't do it to be nosy. Don't do it to judge. Don't do it to spread gossip, to talk about people. Do it because you really honestly care. Because you want to save that person's life. Simple. Point blank, period. Well, again, this is week 3 of Jay Speak Your Truth. I appreciate you taking the time to chime in with me week after week while we speak on the hot topic of suicide. If we could just save somebody, our mission, we're working towards our mission, right? And my mission is to get my crown, to make it into heaven. So, thank you. I hope that you guys have a awesome week. Again, like I said, this has been a trying week for me. I lost someone very special and dear to me. Tremendous loss. A great friend. Who will live on forever, for sure. If you have the time, please just say a prayer of peace, solace for his family and friends. He made a big impact in this world for everyone who knew and came in contact with him. He will be missed tremendously. Again, thank you for tuning in to Jay Speak Your Truth. And I will see you guys next week for week 4. Suicide Awareness Prevention Month. Have a good one.